Assalamu alaikum dear doctors. In this video I am discussing about ventilator settings modes. And for better understanding, first you need to take a pen and a note. Please write all the note what I am telling, then it will be very easy to catch for you. And if you practice it, then it will easily you can understand. Let's start. First we need to know all the normal values. Number 1, VR, that means ventilator rate. Ventilator rate normal value is 60 to 80. Number 2, FiO2. FiO2 means is fraction of inspired oxygen and its normal value is 0.7 to 0.8. Number 3, PIP. PIP means peak inspiratory pressure and its normal value is 18 to 20 centimeter of water. Then 4, PEEP. PEEP. PEEP means peak positive and expiratory pressure. So PEEP normal value is 3 to 5 centimeter of water. Then 5, inspiratory time. Inspiratory time normal value is 0.3 to 0.5 second. 6. Partial pressure of carbon dioxide is 4.6 to 6.4. Easy to remember that partial pressure of carbon dioxide 4.6 then 6.4. Then 7. 7 is partial pressure of oxygen, that is 8 to 12. And at the last, number 8, pH. pH value is, we know, 7.35 to 7.45. Now steps to follow. First step. First we read the scenario, look for the pH if acidic or basic. Remember, first we read the scenario, look for the pH if acidic or basic. Then the second step is look for partial pressure of oxygen and partial pressure of carbon dioxide. So the second step we will see, look for partial pressure of oxygen and partial pressure of carbon dioxide level. Now, if partial pressure of oxygen is low, then we increase the FiO2. If partial pressure of oxygen is high, we decrease FiO2. Remember, if partial pressure of oxygen is low level, then we increase the FiO2, and if partial pressure of oxygen is high level, we decrease the FiO2. Next, we notice the partial pressure of carbon dioxide. If partial pressure of carbon dioxide is low, we decrease the ventilator rate. And if partial pressure of carbon dioxide is high, we increase the ventilator rate. I am again repeating, if partial pressure of carbon dioxide is low, then we decrease the ventilator rate. And if partial pressure of carbon dioxide is high, we increase ventilator rate. Next step. If both partial pressure of oxygen and partial pressure of carbon dioxide in same direction, like if partial pressure of oxygen plus partial pressure of carbon dioxide, both are increasing, then we decrease the PEEP. And if partial pressure of oxygen plus partial pressure of carbon dioxide, both are decreasing, then we increase the PEEP. So, I am again repeating, if partial pressure of oxygen and partial pressure of carbon dioxide both are increasing in same direction, then we decrease the PEEP. If both partial pressure of oxygen and partial pressure of carbon dioxide is decreasing, then we increase the PEEP. Next, if both partial pressure of oxygen and carbon dioxide in opposite direction, like if partial pressure of oxygen is increasing and partial pressure of carbon dioxide is decreasing, then we decrease the PIP. After, if partial pressure of oxygen is decreasing and partial pressure of carbon dioxide is increasing in opposite direction, then we increase the PIP. I am again repeating. If both partial pressure of oxygen and partial pressure of carbon dioxide in opposite direction, like if partial pressure of oxygen is increasing and partial pressure of carbon dioxide is decreasing, then we decrease the PIP. If partial pressure of oxygen is decreasing and partial pressure of carbon dioxide is increasing, then we increase the PIP. Now it's practicing time. If we practice, then our confusion will be much more clear in this matter. So I have taken this question from MRCPCH Theory and Science textbook, case number 37. And the question is, you receive handover from the day team about a 26/40 preterm infant. Weighing is about 1000 gram, who was born by emergency cesarean section due to antepartum hemorrhage. The mother received 1 dose of betamethasone an hour before delivery. The baby was intubated in theatre and given 200 mg per kg of surfactant. The X-ray shows bilateral ground glass changes. He is settled on 20 mcg per kg per hour of morphine and is currently ventilated on SIMB mode with the current settings. And the current settings is ventilator rate is about 60 per minute, inspired oxygen concentration FiO2 is 60%, positive inspiratory pressure PIP is 22 cm of water, Positive in expiratory pressure PEEP, PEEP is 6 cm of water. Inspiratory time IT is 0.4 seconds. Tidal volume is 3.6 ml. Now, from the following list of positive ventilator changes A to J, please select the most appropriate changes for each of the following blood gases. So, what we choose the appropriate change for these cases. First question is about that the neonatal nurse has just done on arterial blood gas which shows pH 7.17, partial pressure of carbon dioxide 8.7 kPa, partial pressure of oxygen 7.6 kPa, bicarbonate level is 23 millimole per liter and base excess is about minus 4.0. So, this is an acidic base. Our first step we see that, and look at for partial pressure of oxygen and partial pressure of carbon dioxide level. Here oxygen level is 7.6. We know that normal oxygen level is 8 to 12. So, oxygen level is slightly decreased, and partial pressure of carbon dioxide is 8.7. We know that partial pressure of carbon dioxide normal level is 4.6 to 6.4. So, oxygen is decreased and partial pressure of carbon dioxide is increased. There is opposite rate. So, according to my previous image, I have shown you some rules. Then, if there is partial pressure of oxygen is decreased and partial pressure of carbon dioxide is increased, then we, cause the setting is increase the PEEP, PIP, peak inspiratory pressure. So, answer number 1 is increase the PIP. Now, question number 2. The neonatal nurse has just done an arterial blood gas which shows pH 7.25, partial pressure of carbon dioxide 6.0 kPa, partial pressure of oxygen 30 kPa, bicarbonate 19 millimole per liter and base excess is minus 4.0. So, first we are seeing that pH of acidic of basic, and we are in the next step we follow, look for the partial pressure of oxygen and partial pressure of carbon dioxide level. So, here partial pressure of oxygen is 30 kPa. We know the normal level is 4 to 12. So, that is so much increase, and then partial pressure of carbon dioxide, if we notice, that is 6.0. We know that the normal value is 4.6 to 6.4. So, that is in normal. So, only partial pressure of carbon dioxide is increased. So, according to the previous image, I have told you all that if partial pressure of oxygen is only decreased, low, then we increase the FiO2, and if partial pressure of oxygen is increased, then we decrease the FiO2. So, here partial pressure of oxygen is 30, that is a huge increase. So, we decrease the FiO2. Reduce the FiO2 is answer of second number question. Now, question number 3. The neonatal nurse has just done an arterial blood gas which shows pH 7.45, partial pressure of carbon dioxide 3.6 kPa, partial pressure of oxygen 8.0 kPa, bicarbonate 28 millimole per liter and base excess is plus 6.0. So, there is acidic of basic, and we notice the next step partial pressure of oxygen and partial pressure of carbon dioxide level. So, here partial pressure of oxygen is 8.0. We know the normal level is 8 to 12. So, it is normal. And if we notice the partial pressure of carbon dioxide, its level is 3.6. We know that the normal level is 4.6 to 6.4. So, that is low. So, if partial pressure of carbon dioxide is only low, on the previous image I tell that then we decrease the ventilatory rate. So, in the third number question, there is only partial pressure of carbon dioxide is decreased. So, according to the previous image, I have tell you that decrease the ventilatory rate. So, the answer of question number 3 is decrease the ventilator rate. So, what are the steps we should take in for increase partial pressure of oxygen? So, increasing partial pressure of oxygen, we can do number 1, increase FiO2, 2, increase PIP, 3, increase inspiratory time, and 4, increase the PEEP. I am again repeating, to increase the partial pressure of oxygen, we can do increase FiO2, increase PIP, increase inspiratory time and increase PEEP. So, if we practice this question, then it is really very much easy and interesting case. And please do subscribe and share my channel everyone. Thank you very much.